After more than 6 months without a head, the World Trade Organization finally has a new boss, with the appointment of the former Nigerian Finance Minister Ngozi Okonjo-Iweala as the Director General, a position that has never before even been occupied by either an African or a woman. The historic decision was taken by consensus as a special meeting of the organization's General Council, made up of 164 member states, when the US, under President Trump, opposed Dr. Okonjo-Iweala's bid. The process was stalled until the Biden administration came in and gave the Nigerian economists its backing. The WTO, of course, faces numerous challenges in its work to settle trade disputes, counter growing protectionism, and help steer the world out of the slump caused by the coronavirus pandemic. Some observers say it's an organization in crisis, but Dr. Okonjo-Iweala said she was ready for the challenges of the job.
All right, joining us now to discuss this further is Dr. ALERO Ann Roberts, a consultant in public health and senior lecturer in maternal and child health at the College of Medicine, University of Lagos. Glad to have you join us on NEWSDAY, Doctor. Let's start this discussion this way. What was your initial reaction when Trump trumped her candidacy? I'm talking about Ngozi Okonjo-Iweala, and then, of course, Biden's administration supported it. And now that she is the numero uno of WTO, we're going to keep you on pause. We're coming back after the break. You will take that question. All right, we still have Dr. ALERO Ann Roberts, a consultant in public health and senior lecturer in maternal and child health at the College of Medicine, University of Lagos. We're glad to have you. And then the question I did pose to you was, what was your initial reaction when Trump trumped Ngozi Okonjo-Iweala's candidacy the first time? And then, of course, later, Biden gave support to her being the WTO chief, and now she's the numero uno at the WTO.
Permit me to.
Go ahead.
It was tremendously exciting and very, very, very encouraging. To be honest, though, we weren't the least bit surprised at former President Trump's trumping of her candidacy at the time. He did know she was going to be a most effective and most wonderful leader of the WTO at a very crucial time in the economy of the world, really. So, I mean, the Biden-Harris endorsement of her candidacy again came as no real surprise. We knew it was only a matter of time. The sad part is that in that time, so many more lives have been lost that need not have been lost had she been able to institute a lot of the things she has said she wants to institute at that time. However, all is not lost. She's there, she's Nigerian, she's a woman, and most importantly, she's a lady. She's committed to her word, she will deliver. May I dance again?
I wasn't seeing you when you were dancing.
With you, actually.
I had to take a peep because of where the monitor is, but yes, you can dance again if you want.
Great. So let's talk about COVID-19 and vaccination, which Dr. Ngozi says is a priority for her as the WTO boss. She said yesterday when she was having a chat with the media that there is nothing wrong in wanting to protect your citizens first by giving them vaccines. But she added that in a time like this with COVID-19, that is different. And it encapsulates the message the WHO has been giving that no one is safe until everyone is safe. So what exactly is so bad and so wrong or so dangerous about wanting to protect your citizens first before others?
Actually, there's nothing, but there is a danger in this overwhelming nationalistic attitudes that we have seen, where some countries are buying up 3-4 times the number of doses that they need for their population size. And, you know, the issue of hoarding is always an issue where things like the World Trade Organization are concerned. Hoarding or monopoly of economies is something that ultimately, you know, in the short term may be of gain to your citizens, but in the long term is detrimental to their welfare and well-being. So, she's right. There's nothing wrong with wanting to protect your citizens, but ultimately, as WHO has said, until everybody is safe, nobody is safe. We know the speed of international travel, we know the speed of border crossings and the speed with which a case can come into the country, that if the country is not safe and if the world does not collaborate to make certain that every last person is safe, then nobody is safe.
Okay, well, seeming to tag on to what my colleague Adesua just said, I'm quoting Ngozi Okonjo-Iweala again now, and she says, to do with vaccine nationalism, it's unconscionable that people will be dying elsewhere, waiting in a queue when we have the technology. But I'm asking, is it as simple as that? You know, what of the corruption, you're on the front lines, that led to our being in a position where we seem to be going hand or cap in hand, looking for handouts? And what of the skepticism around how capable we are in terms of transparency now of stewarding those vaccines when we eventually get them?
Well, there are several issues that have to be considered here, and I am reluctant to put corruption first. What I would like to put first is that basically systems in the country need to be strengthened, and a lot of it has to do with capacity building. And, you know, she did say something that was cogent in her opening statements, and that she said that the private sector is a very important partner to the WTO. The private sector has proved to be an important partner to us in Nigeria, where strengthening the health systems are concerned. We know what happened in 2014 and how the private sector stepped up to the plate. Civil society organizations, NGOs, foundations around the country stepped up to the plate. We've seen it happen again in our emergency response to COVID, in our now community response to COVID. And this is a very important time for us to leverage on those successes and rebuild the health system. We need to revitalize the primary health care system. There's no doubt about that, because anything coming into the country presents first at the very first level of care contact that a person has. And, you know, it's interesting. Times have been very interesting in the past, where we have seen a great deal of work going on in some states, Lagos State, for example, to rebuild a robust health system. So I'm not sure that, you see, it's in the dearth of law and order that corruption can come in. When we have very robust rules, regulations, a robust legislature, a robust implementation plan, there's no room for that kind of thing. There's too much technology now for anybody to hide behind and do their shenanigans anymore. We've got enough technology now for there to be a technological transfer, for instance, of the ability to produce vaccines in country. And that's something that we should be looking at, and certainly something that's with Ngozi Okonjo-Iweala at the helm of affairs at the WTO, we can honestly be hopeful about.
All right, Doctor, let me still stay on the same boulevard as Adesua and Kenneth, talking about the pandemic, the issue of vaccine nationalism. No one is safe until everyone is safe, yes. Now, how does she navigate for all the members to buy into this maxim? For a safer world is one thing to speak, is another thing for people to buy in, and then for everybody to tag along.
Well, one of the first things that she has said, and clearly she knows she's going to do, is to partner with strategic private sector organizations. At the APHPN, for example, we have several very strategic partnerships with CBOs and civil society organizations and foundations. And one of our most important partnerships with the Wellbeing Foundation, we have seen a massive turnaround in the ability to deliver goods and services at the grassroots through midwives, for example. These are simple processes that the new DG knows about, and she will definitely be improving upon. And this has worked not only in Nigeria, in several African countries and low and middle income countries. So the ability to do it is there. We still have our work cut out for us at the grassroots. We still need to be able to go out to the grassroots and build that, create that demand for goods and services in an equitable and accountable manner. That is our job. That's something we have to do, and everybody needs to be all hands on deck. No matter how committed the DG is to this, she's one person. Without a team of collaboration, not only within the WTO, but between the WTO and countries, Nigeria, CBDs, CSOs, private sector organizations, foundations, there's not much she's going to be able to achieve. But with that strategic collaboration, the sky is the limit.
Indeed. And Dr. ALERO, Roberts, despite buying out almost all the available vaccines, even the Western countries have crises on their hands with shortages. In some parts, we're even seeing exports banned because of lack of trust, oversupply. So this is affecting everyone, not just the poorer countries who cannot have access and afford the vaccines, but even those who can afford them are not getting them. So there's a problem of manufacturing here. What more can be done? Dr. Ngozi Okonjo-Iweala mentioned flexibility in manufacturing and talking to partners, but will that be the case? And how possible is that for people to give out their intellectual property rights at this time?
Well, the truth of the matter is what works, works. We know what the Oxford AstraZeneca was doing at the time while they were still developing the vaccine. They were also simultaneously preparing the production and distribution channels. What works, works. There is enough technological knowledge in the world today for this thing to be, for the vaccine production and distribution channels to be set up anywhere that's anywhere in the world, literally. And this is something that we simply have to look at. I mean, the J&J vaccine, which is probably one of the best suited to our cold chain structure right now. I mean, we worked with the foundation, the Wellbeing Foundation, and they were the first to bring back Johnson & Johnson into the country and upskill healthcare workers in emergency obstetric and newborn care. That partnership is in existence. Nothing stops us from leveraging on that partnership to then expand it into vaccine production, vaccine distribution across the nation. So, you know, we have to be a bit nationalistic, we have to be global, we have to be local. And we have the opportunity at this time to do all three. We just need to do it.
Indeed.
Okay. Well, Dr. ALERO Roberts, we love your optimism. We're dancing with you.
And I hope you jump on the Ankara challenge. I'd like to see you in one of those Dr. Ngozi Okonjo-Iweala Ankaras online, perhaps.
Yeah. Yeah.
I shall oblige.
Thank you.
Thank you very much for making the time.
Thank you very much for having me.